Ivermectin is an antiparasitic medication, so it's generally used to treat parasites. Um, in vitro, meaning when they study this drug in petri dishes, at certain doses, they can see that there appears to be some antiviral activity. However, the doses required to treat a person, with this therapy are believed to be roughly 10 times the standard dose. Mm-hmm. So at this point, we don't believe that it's effective for treatment of COVID. The FDA has recently put out a warning to people to avoid using this drug, and there have been patients that have been getting this drug from veterinarians and using sort of animal-grade ivermectin, which are huge doses and can harm people. So they have asked, people not to obtain this for the use of COVID-19. In addition, the manufacturer of the drug, Merck, has also put out a statement advising that their drug not be used for treatment of COVID-19, meaning the people that actually make the drug are telling you not to use it. Right now, there is not good data to show that it works for COVID-19. And the national guidelines that are currently available for treatment of COVID-19 and the ones that have the most credibility are the CDC and NIH guidelines and the Infectious Disease Society of America guidelines. So if you go to idsociety.org and look for COVID treatment, you can see the review of the data for ivermectin against COVID-19, and it's currently not recommended by any of the major medical societies. Unfortunately, there is a lot of misinformation out there regarding ivermectin in social media, and there are many people that are pushing the use of this drug despite not having good data to support its use. And so there are mixed messages that are coming across to people that are worried about COVID. And unfortunately, this is resulting in people using a drug that probably doesn't work and could harm people. So our recommendation within Providence is to follow the guidelines that are laid out by the NIH and the Infectious Society of America for treatment of COVID-19. Those guidelines are the basis for how we treat patients at Providence. And we have been seeing patients come in who are unvaccinated, who are very ill, and them or their families are requesting ivermectin. This is not a medication that we will prescribe in the hospital for treatment of COVID-19. So I would strongly urge people to look to trusted sources of information. In this case, again, NIH and the Infectious Society of America would be trusted sources for how you treat COVID-19. Other sites or things on social media will definitely lead you astray here. There's all sorts of remedies that are being promoted on social media, things like vitamin C, hydroxychloroquine, and other things that really have no role in the treatment of COVID-19 in August 2021.